And so Tatum, you are the next speaker, if you'd like to give your presentation, which is on the use of artificial intelligence in patients with carotid artery disease to try to look at the plaque morphology.
Do I pull it up on here as well? Shouldn't. Right. Fine. Hi, my name is Tatum. I'm a surgical resident currently living in the UK. I'm here to present on the use of AI in carotid plaque morphology. I'm presenting on behalf of my partner Jack Parker, who is the CEO of Ayatella, an AI company, as well as the Arizona Heart Foundation. That includes both Eileen Spangler, who is our ultrasound technician that works with the ultrasound school there at the Arizona Heart Foundation, and Paula Banahan, the CEO, as well as Mr. Reed and Mr. Hamed, who couldn't be here today. Our study utilizing AI, and kind of the question that we're asking is, how do we define high-risk carotid plaques, when to intervene on them, what are the best interventions for high-risk plaques, and that's in patients who are both asymptomatic or symptomatic. So despite symptom presentation, what constitutes a high-risk plaque? And historically, it's really been by percent of stenosis, but vascular surgeons have been interested in carotid plaque morphology for many years. It was mostly due in part to the works by Dr. Wheelgray and Lusby, from Australia, New Zealand in the 80s. They started looking at carotid plaque morphology in both asymptomatic and asymptomatic vessels, trying to see their risk of stroke, their kind of qualities about that plaque that would define them as high risk. It was through the work of Professor Andrew Nicolaides and his study, the ACSRS study, in which he looked at over 1,000 patients, asymptomatic patients, where he defined significant carotid plaque characteristics. So apart from the percentage of the stenosis of the plaque within the vessel, there are other plaque characteristics that have been proven by him and his team through these large patient studies that are statistically significant and indicative of a high-risk plaque. So plaque area, these discrete white areas, which are very small vascular areas within the plaque, and the grayscale median. Most notably is the juxtaluminal black area, and again, through his group, it is one of the morphological features of the carotid plaque that does indicate it's at high risk of then causing stroke. I'm going to then, this is my partner, Jack, he's not here now currently, but he has recorded this from Finland. He will be describing the way that we're using AI to essentially look at these carotid characteristics and analyze the morphology of the plaque. It has been established that they do indicate a high-risk plaque. However, it is very time-consuming, and it is something that hasn't been easily kind of tangible for us to do at the bedside. So what we are doing is applying AI to an ultrasound image and then extracting those morphological features that will then help us define which carotid plaques are at high risk of causing stroke within seconds of the time of the patient having an ultrasound of their carotids. So I'll let this video play.
Hello. To train an AI to detect the key plaque features that Dr. Jackson just described to us, we first need to train the AI to detect and quantify plaque from ultrasound imaging. What you're seeing on the left is the first iteration of our AI, in which it would detect the lumen potential areas of plaque and calcification. Now on the right, you will see that we can automatically 3D model the patient's specific anatomy with the plaque in situ. That plaque is quantified and can be automatically generated into a report. Now, to characterize that plaque, first we normalize all of the imaging that the AI sees. Then the AI can predict total plaque morphology as well as the area of that plaque. The AI also detects just juxtaluminal black areas, as Dr. Jackson described, as well as distinct white areas, which are perhaps the easiest feature to identify. In this specific patient example, the AI discovered what it termed an extreme morphology, which we later discovered to be a carotid web, which of course tend to be a high risk for thrombus formation. Of note here is that this was not identified in subsequent CTA imaging, from which comes the recommendation to consider both ultrasound and CTA imaging when diagnosing and planning the intervention using this plaque feature analysis. So we've trained an AI to identify those key plaque features, but how do we really know what is a high risk feature of a plaque? Well, we intend to investigate that by applying the AI to a retrospective patient cohort. Patients which have had confirmed stenosis by ultrasound without intervention and then went on to have a cerebrovascular event. By collating those two data points, we intend to identify potentially high-risk plaque features, which we'll then further investigate in a prospective population study. Thank you.
Right. So next steps for this project, this is our early initial work. It's really training the AI to learn what these, to identify these plaque characteristics. It's a matter of doing it within seconds using ultrasound as our modality to do so. We are continuing a collaboration that was established by my grandfather, Dr. Dietrich, with Professor Petrov here at the City Clinic in terms of our prospective study and applying this AI to patient scans to help train the AI, but as well as then start categorizing patients in a prospective, follow them up, what is their kind of outcomes and interventions to help determine high-risk plaques. In addition, we are looking to do prospective studies with a couple other countries within Europe, including Finland and Iceland, and that we're more of an asymptomatic scanning protocol in which we can, there's not currently the need, or guidelines say there is not a need at the moment for scanning asymptomatic patients for stroke. However, with this AI and the ability it can to quickly detect high-risk strokes, it has been of interest from different institutions to try to apply this and establish a screening program. So it's something that also we are doing as next steps moving forward, which is exciting. We're happy to be here and working with Professor Petrov. So that's the end of my talk. Thank you.
Any questions, anybody?
No.
Any questions on that?
Yeah.
You have one? Oops.
Don't worry. Thank you. It's very interesting that you are, I'm from the older school, but at this time, the EI, do you think it's going to help us diagnosis, prognosis, or treatment?
I think the question where it originated from was when to intervene in the patients who are at high risk of having a stroke at time of intervention. And then the plaques that they're not symptomatic, so asymptomatic patients, when do we treat them, how best to treat them? And I do think that if it can help quickly and with ultrasound, you can apply it to CTAs or MRIs and things like that, but I think with ultrasound, to be able to say that plaque has those characteristics and therefore you are at a higher risk of having a stroke, I think it does change then how you would manage the patient. So it would be almost establishing that protocol for them. So I do think it would, from all stages, we're hoping to apply it in a preventative way, in that this is the best management for you, and if it is medical management throughout the course of what they need it for, then they have that, or at this point in time, we would recommend then intervening on that plaque. So I think it answers the question from a treatment point of view, but also then the outcomes for the patients, how often they need to be followed up. If a patient is asymptomatic, but they have a high-risk plaque, then that does it is good management then to start them early prior to then waiting for a symptom to present, which is what kind of the protocols are having at the moment. All of our screening programs, they're not there. It's just at first time of presentation, and then you get your carotids looked at. With the indication, the amount of strokes, and as Professor Petrov said at the start this morning, it is a life-limiting disease. It is occurring. I think that knowing more about the plaque morphology is helpful for treatment protocols. it's just time consuming, and it's something that it's been done, as Professor Nicolaides has been studying it, and we are working with him, we're working with his team, but the AI makes it fast and it makes it available.
Yeah, I think it's cheaper.
Cheaper, yeah.
It's cheaper. It's healthier for the patient because it's an ultrasound. You don't have to go to the CT scan, or maybe you don't have to go to an angiogram, for example, or MRI. So another question is, you are following the patients you are going to following the patients through the years to see how the plaques change?
I think at the moment, it's mostly retrospective studies. So with the Arizona Heart Foundation, they have an ultrasound school, and we're using quite a lot of their ultrasound scans to kind of train the robot, is what I say. Just feed it into the AI, and so it gets to know how to read these scans. So it's establishing that the AI can detect those characteristics, which it can, and then it's initiating an ultrasound protocol in which for patients then that would undergo carotid ultrasound, we would like to implement our protocol. Yeah. And then, yes, follow them along. Yeah.
Okay, perfectly. Yeah, it's pretty interesting because we have new things for the AI.
Yeah.
I mean, artificial intelligence can help us to see the diseases in a different way, to prevent, to follow up, and to know what to do.
I think it's utilizing AI in terms of exactly the treatment and prevention. A lot of it in vascular surgery at the moment that it's being used for is just imaging, and I think, but not necessarily then changing the way that either we would screen or we would treat a patient for their pathology. So, yeah, it is. I know that AI is kind of everywhere, but hopefully, it's something that can be readily available and cheap and fast to then, do that.
Yeah. Do you have any questions? No? Well, thank you very much. Very interesting.
Thank you.